Hey all, Dr. J here with you again, and in this particular video we're going to talk about another couple sets of terms. In the previous video we talked about medial, lateral, and also anterior, posterior. Today we're going to talk about superior, inferior, proximal, and distal as they relate to the skeletal system, but of course you can apply these to all of anatomy as you learn anatomy, and they come in handy as part of the language of anatomy. So remember, we need to refer back to this particular position called anatomic position. So I had you practice this wherever you were when you watched the last video. Feel free to do that again today. Just stand up and refer back to this position so you can visualize and see this position. But remember, anatomic position is basically you're standing upright, your eyes are facing forward, your knees are facing forward, your feet are flat on the ground, and your palms are facing forward. So even if you take your leg and put it behind your other leg, or take your right elbow and put it behind your back, you still refer back to this particular position in which, for example, your thumbs are lateral to your pinkies are medial to your thumbs, your eyes are anterior structures, your gluteus maximus is posterior. So in the last video, the previous video, we looked at anterior, posterior, medial, lateral. Remember, anterior is toward the front, posterior is toward the back, medial is toward midline. So your breastbone, your nose, your umbilicus are midline structures or medial structures. And then lateral is away from midline, away from the central part of the body. So your ears are lateral, your limbs in general to the rest of your body, for example, your upper limb, these are lateral. So let's talk about superior now. Superior is toward the head or above. So in relationship to the rest of the body, superior structures include these following structures: the head, the eyes, the ears, the neck, the mouth, as related to the entire rest of the body. These are superior. So then you can do relations. So for example, the eyes are superior to the mouth. Your neck is superior to the breastbone or the sternum. Your belly button is superior to the pelvis, and then the thigh is superior to the foot. Although with the thigh and the foot, we can add some additional layers to this and talk about proximal and distal as well. But let's just start there with the thigh superior to the foot. The thigh is above, toward the head compared to the foot. So in this, the picture of the kayaker here, toward the top of the image, the head is the superior aspect of the kayaker, and then the life vest is covering over the torso. That is in fact inferior to the head, and we'll go ahead and dive into inferior here in just a moment. This is the most superior aspect of the skeletal system, the skull. So compared to the entire rest of the skeleton, the skull is the most superior aspect. So then we can talk about inferior. Inferior is toward the feet or below. So as related to the rest of the body, these are inferior structures. For example, the ankle, the foot, the toes, the Achilles tendon. And the Achilles tendon, for example, for reference here, is how the calf muscles attach to the ankle. So you probably already know where that is, behind your ankle essentially. So as related to the rest of the body, here are some examples of inferior structures, and I'm sure you can think of other examples as well. So you're looking at the inferior aspect of this man as he changes his shoes. And then here is the ankle foot. So you're seeing the skeletal anatomy here. You can see the tarsal bones to the left of the image, and then the metatarsals and phalanges on the right side of the image. The most inferior aspect of the entire skeleton here. So now let's talk about proximal and distal. Proximal is toward the origin or point of attachment for something. In this case, we're talking about skeletal structures. So for the proximal structures related to the upper limb, the lower limb, and also considering a single bone, for the upper limb begins basically at the shoulder, where the shoulder, the head of the humerus, links up with the scapula and the clavicle, primarily the scapula. And this is where the upper limb is beginning. So the shoulder, the head of the humerus, is considered the proximal aspect of the upper limb. For the lower limb begins at the pelvis, essentially. The pelvis anchors the lower limb to the axial skeleton. So the head of the femur, the hip, are considered the proximal aspects of the lower limb. And then for a single bone, you could talk about the head of the radius, which is the proximal part of the radius. toward the elbow, and then the head of the fibula is another example. It's toward the knee as opposed to toward the ankle. So where does a particular limb start? Wherever that is, closer to where that origin or point of attachment is located is considered proximal. So there's the head of the femur in the left image, a proximal aspect of basically the entire lower limb, but in particular for the femur itself. And you can see a close-up image there on the right where the head of the femur links up with the lateral part of the pelvis. Proximal aspect of the tibia is on the left. This is the part that's closest to the knee. And same thing with the fibula on the right. The proximal aspect of the fibula is closest to the knee, basically where the fibula first links up near the knee. And then the distal aspect of both of these bones is considered the lower part of the image. Proximal part of the humerus in the left image, and then the proximal aspect of the radius in the image of the right. And so you can know that's the radius by its disc-like head there, which is where the arrow is pointing currently. So then distal is away from the origin or point of attachment, and so distal structures include the following. So we can do the same thing with the upper lower limb and also a single bone. So for the upper limb, distal aspect of the entire upper limb is the wrist and the hand. For the lower limb, that consists of the ankle and the foot. And for a single bone, you could talk about the trochlea of the humerus, which is the most distal aspect of the humerus, where it links up with the ulna, and this is basically at the elbow joint. Or you could talk about the medial malleolus of the tibia, which within your shoe, or if you have your shoes off currently, you can feel a bulge on the medial aspect of your ankle, so that's considered on the same side as your big toe. That's the medial malleolus. So there's a picture of the distal upper limb, and so that's the wrist and the hands. You can see the carpal bones, the right side of the image. Then we have metacarpals and phalanges as we move from right to left. There's the distal lower limb, ankle, foot. So tarsal bones to the left, metatarsals and phalanges as we move from left to right. And so we'll talk about these in more detail as we dive into the different regions of the skeleton. So there's the distal aspect of the humerus on the left, and so I did refer to the trochlea, and so you're seeing that highlighted there. And then we have the medial malleolus in the right image. This is the distal aspect of the tibia, the bone of the shin. So these arrows actually depict movement in a more proximal direction and a movement in a more distal direction. So the blue arrow is showing us we are moving proximally toward the origin of the entire lower limb. And then the red arrow shows distal. You're actually moving distally toward away from that point of attachment or origin for the entire lower limb. Same thing for this set of arrows. You have a proximal blue arrow and you have a distal red arrow moving further away from the point of attachment or origin for the entire upper limb, away from the shoulder. For the kayaker, we have the blue showing proximal, movement toward proximal, or you're moving proximally as it pertains to the entire upper limb. And then there's the distal arrow, moving distally as you approach the wrist and the hand. So let's talk about superior inferior. Blue shows a movement superiorly toward the top, the very top of the skull. And then the red arrow is showing us we're moving in the direction inferior to the inferior aspect of the skull. We could do medial lateral. So blue is showing a movement medially toward the middle of the skull, and then the red is movement laterally toward the outside of the skull, away from midline. So we talked about superior, inferior, proximal, and distal in this particular video. Superior is toward the head, inferior is toward the feet, proximal is closer to that point of attachment or origin, and distal is further away from that point of attachment or point of origin. So in the next video, we're going to talk about terms of movement. We're going to talk about flexion and extension, abduction and adduction, and also circumduction. And so feel free to tune in for the next video, and also head over to anatomyonthego.com, where I have additional resources to help you learn the human skeleton and all these terms, and to help you learn anatomy in general. I'll see you in the next video.